Hello, I'm Dr. Wayne Young from Young Hair Restoration. If you're thinking about having a hair transplant, don't book anything until you've watched this video. In the next few minutes, I'll show you 10 warning signs that could save your donor area, your money, and years of disappointment. Every week, I meet patients seeking corrective hair transplant surgery. Many chose a clinic based primarily on price. Unfortunately, some now have unnatural hairlines, poor density, or permanent donor area damage. The most important thing to understand is this: a hair transplant is permanent. You only have one donor area, and every graft removed is a precious resource. So, let's look at the 10 warning signs every patient should know. Warning sign 1: you never meet the doctor. A proper consultation should be with the doctor responsible for your treatment. Your hair loss should be assessed carefully. Your donor area should be examined. Your future hair loss should be discussed. If you never meet the doctor before surgery, ask yourself why. Warning. Sign 2: you don't know who is performing the procedure. Many patients assume the doctor performs every part of the surgery. That isn't always the case. Ask these questions: who designs my hairline? Who removes the grafts? Who designs my hairline? Who removes the grafts? Who implants the follicles with implanters? Understanding exactly who performs each step helps you make an informed decision. Warning sign 3: there is no long-term plan. Hair loss usually continues throughout life. Long-term planning is one of the foundations of natural hair restoration. Warning sign 4: poor donor area management. This is one of the biggest problems I see in corrective surgery. Your donor area is limited. Once follicles are removed, they cannot be replaced. If too many grafts are taken, future options become much more limited. Protecting the donor area should always be a priority. Warning sign 5: an unnatural hairline. The hairline is the first thing people notice. Natural hairlines are never perfectly straight. They vary with age, facial shape, ethnicity, and gender. A well-designed hairline should still look natural many years into the future. Warning sign 6: promises that sound too good. Be cautious if you promise unrealistic density without a thorough assessment. Every patient is different. A personalized treatment plan is far more important than impressive marketing claims. Warning sign 7: choosing on price alone. Cost is important. I understand that. But a hair transplant is a lifelong procedure. A cheaper operation today can become far more expensive if corrective surgery is needed later. Value isn't just about price. It's about experience, planning, safety, and long-term results. Warning sign 8: no long-term results. Ask to see results 1 year after surgery. Even better, ask to see results 3 or 5 years later. The goal isn't simply to grow hair. The goal is to achieve a result that still looks natural many years later. Warning. Sign 9: poor aftercare. Ask who will look after you after surgery. Who answers your questions? Who manages any complications if they occur? Good aftercare is an essential part of successful treatment. Warning sign 10: trust your instincts. If you feel rushed, if your questions aren't answered, if the consultation feels more like a sales appointment than a medical consultation, take your time. A hair transplant is a major decision. You should never feel pressured. Choosing the right clinic isn't about finding the cheapest option. It's about finding a clinic that takes the time to understand your goals, assess your donor area, and develop a long-term plan that's right for you. Remember, your donor hair is a finite resource. Protect it.